Hello, this is Jessyka Heredia, and I'm reporting for East County Magazine. Today I'm sitting down with Dr. Akilah Weber, and she's running for state senate. Hello, Akilah. How are you doing today?
I'm good. Thank you so much for asking. How are you?
I'm good, thank you. Thank you so much for joining us. We know you're busy out there campaigning and doing your job as state assembly member currently. Go ahead and tell us a little bit about your background and, kind of your accomplishments to get you to this point.
Okay, well, once again, thank you so much for having me today. I am Dr. Akilah Weber. I am a native San Diegan, was born and raised in both the Assembly District 79 and the Senate District 39. I am a board certified OBGYN. I specialize in pediatric and adolescent gynecology. After graduating, I left for a few years and came back in 2013. I was on faculty at UCSD, and I also founded and directed the pediatric and adolescent gynecology division at Rady Children's, where I still have my practice today. Um, in 2018, I was living in La Mesa and realized that we needed more diversity on the council, not only with race and gender, but also in background, because many of them had a legal background. Also, none of them at the time had young children, and La Mesa is a growing city, very, very family friendly. And I just felt like we needed much more of a diverse input on the policies that that city was going to be putting forward. And so I ran and was successful. I joined the La Mesa City Council in 2018, worked on a variety of different issues, such as implementing our climate action plan, dealing with the policing in our city. Unfortunately, that was the time when we had those unfortunate riots that occurred. Also dealt with a lot of the other local issues at the time. And then the pandemic hit and helped kind of guide the city through some of the guidelines that we had to do at that point. Also worked a lot with the foundation, the establishment of the issues of homelessness that we were dealing with in La Mesa, and really had our people think outside of the box to see where else in the country could we model a program that it was successful, and kind of tweak it to what we could do in La Mesa. And that's why they have such an amazing homeless program at
Sorry,
this point. Oh,
sorry.
oh, it's okay.
We're done. Oh, done. The dog walked by.
Oh, no, that's
Hey,
fine.
hey, buddy, stop. Okay.
No, that's fine. So I did a lot of things locally. In 2021, the assembly seat open became vacant. I ran for it for the same reasons that I ran for the assembly, which was to make sure that we had different kind of voices in Sacramento making some of the policy decisions that impact everyone here in California's life. I was very successful since I've been in Sacramento since April of 2021. I've had around 18 bills signed. I focus on the social determinants of health because that is really truly what creates healthy or unhealthy communities. And that encompasses everything that we interact with, where you live, the school you go to, the type of education you get, the air that you breathe, the water that you drink, how far away your job is, other kind of environmental stressors, and really make sure from my end, but also educating my other legislative colleagues that what we do in Sacramento, whether it is directly health related, it will impact health because 80% of your health is dealt with what happens to you, not from society, not what happens when you actually go to a doctor or a clinic's office. And so I've really focused a lot on that. And so all of my bills, whether they're education, environmental, housing, health, really deal with how we can create healthier communities through all of these different policy avenues.
It's wonderful. Congratulations. I did look up your accomplishments a little bit beforehand, and I was impressed with the legislation that you brought forward. Very
Thank
good.
you.
And I mean, for one term up there, especially. So good job. And then let's talk about education. And because I know that that's part of what's important to you as well. I know that, there's been some talk of test scores being down, and I'm sure COVID relates to that. What kind of things would you like to do as state assembly to get TK through 12 to have better test scores and more accomplishments?
Yeah, thank you. So that is one of my focus areas. I am a mom of two children who are going through our education system. I have a 10-year-old who's in fifth grade and a 12-year-old who is in sixth grade right now. And in California, it's interesting. We have amazing universities. We have some of the best universities in the country. People are scrambling, not only throughout this country, but internationally to get into our universities.
Mhm.
Unfortunately, with our TK through 12 system, we are not adequately preparing every single child in our state to be competitive to get into our own universities, whether they're the CSUs or the UCs. Not stating that every child has to do that, but every child should have the option and the opportunity to do so if he or she chooses that. And so we have a lot of work to do, and it is something that I have been working on in the assembly, and I plan on continuing to work on in the Senate. One of the things that I did, and I worked very closely with the governor's office on this, is ensuring that we are focusing on our lowest performing students.
Mhm.
Because we need to make sure that those who are our lowest performers are getting more resources, getting more finances, so that we could put programs in place to address whatever it is that they need to implement their scores or to bring up their scores. And so this was actually something that my mom had kind of worked on before. She was able to secure, when she was in the legislature, $300 million one time. And I was very, very excited that working with the governor's office and also the California Legislative Black Caucus, that I was able to secure an ongoing 300 million. So not one time, but ongoing, for
Wow.
the state to focus resources on the lowest performing students. We also got word recently that the governor wants to bump up that amount, but we'll see what happens because the budget is a little wonky right now. But I really believe that our advocacy and my discussions with the governor and his team about the fact that we really have to focus on our students at the bottom. When you improve things for those at the bottom, you really lift everybody up. The other thing that we have to do, and this is not just with education, but we have got to have more oversight. It just boggles my mind how much money through the state we have spent out on different programs and passed certain legislation. And there has been no oversight to go back to say, hey, first of all, has this thing even been implemented? Because a
Right.
lot of times people come through and they say, oh, I passed a bill on that 2 years ago. And then they realize that the department hasn't even implemented that yet, right?
Mhm.
So number one, has it been done?
Right.
Two, is it working? Is
Mhm.
it working? And we have not been doing that to say, yes, this is working, let's continue down the course, or no, it's not working, we need to shift and do something else. And if it's not working, like, who is accountable to make sure that it's working? If it hasn't been implemented, who is accountable for not making sure that these things have been implemented? So we lack at the state.
Oh, I can't hear you. Doesn't- Oh, you're frozen. Okay, no. I can't hear you. Are you on mute? Let
No,
me see.
I'm not on
Oh, there it
mute.
is. You're in now. You're
I don't
back.
know what happened.
I don't know.
Okay.
Might have been a connection issue.
All right.
So
But
sorry.
basically, no, it's fine. Basically, I was just saying that we need more oversight and accountability. So when we talk about improving the academic outcome of students here in California, we need to ensure that those who need more are getting more. We need to ensure that we have oversight and accountability of the programs that we put in place. And if they're not working, be able to pivot and change. And we also need to ensure that we are paying our teachers and our administrative staff adequately for the amount of time and the things that we are asking them to do.
Right. Okay, well, I love that. I love accountability and I like the oversight idea. I think that's really, really smart. As far as the universities go, I know the costs of college are expensive, and yeah, I know, I have a college graduate, recent college graduate, for my daughter, and we were both kind of shocked at the cost of college. What can we do at the state level with the state senate to keep the costs down? And that way we can have more people attend that want to attend. And I know like the middle class sort of gets a hard time in there too. So what are your ideas to make it a little bit more accessible for people and keeping the
Yeah,
costs
so
down?
yeah, so when you talk about accessibility for our higher institutions of learning here in California, it's twofold. One, can my child actually get in? And a part of that is ensuring academically they are competitive as anyone else outside of California. The other part has to do with the number of slots that they have allotted for in-state versus out of state. And I'm so happy, and you may have seen this about a year ago. We voted to increase the number of slots for our colleges here, specifically for in-state students, because in our public universities, we're paying for these amazing institutions, and
Mhm.
our children should be able to get in, right?
Yeah.
And so we have increased the number of slots. We are watching that very closely, and committed to having to increase them even more if necessary. So that's number one. And number two, with the issue of affordability, we are also looking at that very carefully. I sat on the higher ed committee in the assembly for about maybe about 2 years, I think. This
Mhm.
is the first year that I'm not on it. And, when it comes up, when things are coming up about student fee or student tuition increases or student fees increases, those are dealt with and looked at very closely, and oftentimes not approved, because we know that it is extremely difficult for our students. Colleges are very, very expensive. And the other thing is just making sure that we have various grants and opportunities, loan opportunities, interest-free loan opportunities for our California residents to be able to attend our schools here in California.
Awesome. Thank you. Thank you for what you do
Mhm.
in education already. We really appreciate it. And then let's talk about healthcare a little bit because that's another concern for most people. What are ideas that you have to improve access to good, affordable healthcare for more Californians if elected to state senate?
Yeah. So healthcare is something that I am very, very passionate about. Access is extremely important. I'm glad that you asked about access,
Mhm.
because a lot of people talk about being insured, and
Mhm.
having insurance does not guarantee access. So you can have health insurance, but if your next physician or your primary care provider is an hour away, that's not having access. If the specialist that you need to see is 2 hours away, that's not having access. And so access really is the key. I have, this is my second year on the health committee in the assembly. I'm currently chair of health budget on the assembly side.
Mhm.
And so this is something that I am focusing on literally every week when I am up in Sacramento. One of the issues that we have got to address is reimbursement rates.
Mhm.
We have got to ensure that our providers are getting reimbursed at a rate where they can afford to see everybody, regardless of your insurance, regardless of what type of insurance you have. And unfortunately, right now, we don't have that.
Mhm.
We just are getting ready to pass through the budget. We voted on it last year. We're going to go back to the federal government, fingers crossed, to get some more money. It's something called the MCO tax, Managed Care Organization tax. Excuse me.
Mhm.
This is really groundbreaking because it's the first time in a very, 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 very long time that the state has actually invested into our healthcare system, into our Medi-Cal system. And so this is actually, it's not a tax on the people, but it's a tax on various insurance companies and entities to ensure that those funds are going back into the healthcare system as they should. And so that is able to increase the reimbursement rates for our primary care providers, because we know there's a shortage of them,
Mhm.
for our OBGYNs and other providers within the realm of maternity care, and extremely important today in our behavioral health system, because we need a lot more providers within our behavioral health system. So we are putting more money in to increase the reimbursement rates, increase access, increase the number of providers in those particular areas. Additionally, we have another issue up and down the state. We haven't had this in San Diego so far as too much of a problem, knock on wood, but we have hospitals closing. And so because of lack of finances, and so last year we did the hospital distress loan to try to keep some of their doors open. And couple of weeks in health budget hearing, I will have a hearing specific on hospital financing and what we can do long term to be able to ensure that hospitals are able to keep their doors open. And because once those close, that is also an access issue. I also have a bill this year that specifically deals with maternity ward closing, labor and delivery unit closing. That is an issue as well. And so this would be a situation where we at the state would be able to find out earlier if a hospital is thinking that they're going to need to close their labor and delivery unit, so that we can work with them. We can do a community assessment to see, okay, if this L&D unit closes, where's the next one for those individuals to be able to go to? Is it 2 hours away versus, 2 miles away? And so these are some of the things that I have worked on and are continuing to work on to ensure that people not only have insurance, because here in California, we've done a pretty good job of that. The issue that we have is really with access.
Yeah, absolutely. Thank you. Again, on a little bit more about healthcare, with some states banning abortion, how can you help protect a woman's choice here in California? And do you oppose allowing women from other states to come here to receive care and protect their identity in the process?
Yeah, so that is a great question. I am I am an OBGYN, so women's reproductive health is extremely important to me. When Roe v. Wade was overturned, I was in the California State Legislature, and I thought, wow, this is an interesting time to have an OBGYN in the legislature helping craft some of these legislation and policies. California has done very, very well in the area of protecting reproductive rights, protecting a woman's right to choose. We are now, as you probably know, it's enshrined, in our Constitution. And a lot of the bills that we have passed to ensure that you can get a safe abortion here without having a lot of different barriers, such as cost or access, are bills that I have either signed on as a co-author or have been a co-author myself. I was able to secure funding in the budget as well to ensure that cost would not be a barrier to these women. Also, the legal issue that providers would not be held legally liable either here in California or anywhere else if they perform these procedures for women. And also that California would be a safe haven for women outside of California to be able to come to. As an OBGYN, I do believe that, it is a woman's right to choose, and that having access to comprehensive reproductive health care is good health care. And if we don't have it, we are doing a disservice to members of our own community. And, a community can be as small as the people in your neighborhood, but it could be as large as the people throughout the state or throughout this nation. And so it is something that I support, ensuring that we provide access and education. And if those outside of California need to come to California, that we have the ability and the providers to provide them with that very vital service as well.
Okay, thank you. And then the California budget. After the recent storms, there is a bigger need for funding in our local communities. The state budget is experiencing a deficit of, I believe, over $60 million. And what ideas do you have to improve the budget while not cutting crucial funds for underserved communities?
Yeah. So, depending on who you ask, I'm gonna lean towards, the LAO's projection of 78 billion deficit with at least 30 million ongoing for the next few years, at least. it is a huge issue. And, with the recent floods, many of those were within my district, District 79. Um, that is an example of a lack, I think, of focus from local government to ensure that all areas are prepared, all areas are cleaned out, all areas, especially those that have already been designated a potential danger zone, a potential threat, flood area, flood threat, are prepared and ready as much as possible. I am very happy that the federal government has stepped in and stated that, yes, this is an area that qualifies for FEMA funding, so that those individuals who unfortunately had significant damage to their property, damage to their homes, lost their homes, will be able to get federal financial assistance to help with that. Um, you know, like I said before, I am over health budget, but as chair of health budget, I am a part of the entire general budget committee.
Mm-hmm.
And this is something that we are discussing multiple times a week, the status of our finances here in California. And not just how do we get through this year, but how do we set up a scenario where future years are not in such a crisis as we are now, recognizing that California is in a much better place than they were before when they had the recession, because we do have a very hefty, what we call kind of like rainy day fund or reserves. But, we are looking through and we are going line by line, and we are having budget hearings every week to really do the due diligence. And I talked earlier about oversight, and looking to see what's working and what's not working. Are we funding programs that are fully utilizing the money? How can we also go back and look and see where are some other pots? And when I talked about the MCO tax and us going back to the federal government, asking for more money, so that we don't have to cut any healthcare services on this side, by looking at this new potential pot of money that could help backfill some of those things. And so we're looking and we're discussing at all of those things, because with the previous recession, there were deep cuts to some very significant programs. Mm-hmm. And it has taken us a while to get back to where we were with some of those things. And unfortunately, many times you can never make something whole again once you've already started those cuts. And we are very cognizant of that, and making sure that whatever we're looking at potentially cutting, again, seeing who is utilizing their resources, what programs are actually working, what are the consequences if we actually do cut, certain programs. And, we're being very deliberate to not try to cut some of the critical programs that people need this time to survive. There are a lot of nice things to have, right? But there are some very critical things that people need. They need to be able to be housed. They need to be able to have access to healthcare. They need to be able to get quality education. They need to be able to not wonder where their next meal is going to come from. Those are the things that people need to survive. And while some other things that we have done and we have funded are very nice and maybe very beautiful and great to say that we're doing this here in California, when you are in a situation where you are in a budget deficit, you really have to ensure that you are maintaining the programs and services that people need to just survive. And that's what we're doing.
Awesome. Awesome. Thank you so much. And I know when you served in the 79th State Assembly seat that you have now, you were really focused, it seemed, a lot on Parks and Rec and community engagement, and the community engagement centered around families particularly. What are your goals and priorities as a state senator that you think you'd like to accomplish up in that level?
Yeah, I'm very I think it's very fortunate that I served at a local level before I went to the state level, because it's really at the local level where people feel things on a daily basis. If you don't have a park to go and play with your kid, or just walk, or your dog, that's an issue. If you don't have, the funding to improve your roads and everything's bumpy, and when, you've got cracks and crevices here, and recognizing that cities, especially our smaller cities, are very crunched in terms of the finances that they have. And that has been one of my biggest joys of being in Sacramento, is being able to provide some of those resources back into the community that people need. So my first year when I went up there, my kids had played for La Mesa National, and right before I went to Sacramento, I've been working with them, with the city, to try to install a bathroom. This was like I don't know, a 15-year ordeal to get a bathroom at our big Major League Baseball park in MacArthur Park. And the reality is that the city really didn't have the funds for it. You only have a certain amount of funds. You've got a lot of different projects that you're trying to do. And so when I went up to Sacramento, I said, this is one of the things that I would like for us to fund. It's not a lot of money from the state's perspective, right? But it touches the community and it has such an impact. And so I'm so happy that we were able to work through that. And that bathroom is there now. So people are able to go to a bathroom, whether they're walking their dogs at MacArthur Park or, at a baseball game. So my experience from a local level has made me never forget the community, right? Up there in Sacramento, you're dealing with a bunch of different stuff. You're kind of view things from a different perspective. But I never forget what's happening on a local level, because I know how hard it is for local officials, and how much the communities need just sometimes just the basic things. We talk about funding these huge programs from the state, but sometimes you just need the basic things to improve the quality of life in the community in which you live.
Absolutely. Well, thank you so much. I really look forward to watching your campaign and see what happens, and we'll be reaching out again after the primary, I'm sure.
Okay.
Thank you, and congratulations on your campaign.
Oh, well, thank you.
Congratulations.
And thank you so much for reaching out.
Yeah, no, we appreciate you. Thank you. Good luck, and we'll talk to you soon.
All right. Bye.
Bye-bye.